Hello, this is my critical assignment, injury identification, assessment, and prevention. My name is Moises Flores, and I'm in KIN 353. Thank you. So, the sport I chose was folk style wrestling. The three most common injuries in folk style wrestling would be shoulder strain slash tear, MCL strain slash tear, and perpetular bursitis. The factors that may cause injury are age, gender, body composition, previous injuries, fitness level, and skill level. And in wrestling, you will get injuries in wrestling. So it doesn't matter. But I feel like a lot of girls that are younger do tend to have more injuries because women have a less, muscle and bone structure, and like they don't take it like, they can't take a hit like the guys do. So I would say in wrestling, the girls have it rough, but the guys, they could take a lot of trauma to their body. So yeah. Okay, so shoulder strain slash tear. A shoulder strain commonly takes place when the muscle in the shoulders are experiencing a lot of pressure or over extended period of time. While wrestling, it could happen when they use the shoulder to push someone off or use a move such as the hammerlock or an armbar, which can use a huge amount of stress for the shoulders, and that typically, causes injury. The muscles affected by the shoulder strain is the infraspinatus, scapularitis, laris, supraspinatus, and teres minor, which are the muscles that normally will get strained. The tendons that will be affected would be the rotator cuff, like in itself, like the whole thing could be messed up. That is made up from the like four separate tendons that cover up the shoulder. And for the ligaments, the only thing that could happen to those is an overstretch, and that also could cause a strain in the shoulder. So, shoulder strain tear assessment test and treatment. So there's two assessments for a shoulder strain slash tear. The first one would be a drop arm test. That's when a doctor holds your arm up and lets it drop, and you'll have to tell them if it actually hurts or not. And that usually determines if there's an injury in the rotator cuff. Okay, second one would be Job's test. Job's test is an assessment at 90 degrees of the abduction and the neutral rotation when they rotate the shoulder and angle it towards 30 degree while the doctor applies pressure through the test. So 90 degrees. Oh Jesus. And then when it goes to a 30 degree, you'll have to tell the doctor if that hurts. Okay, so the treatment would be resting, icing, taking painkillers, and having compression on the shoulder. Like a shoulder sleeve would be amazing, and not moving at all would help the healing process. Yes. So shoulder strain tears and exercises. So for primitive exercises, two for the agonist would be doorway stretch and passive external rotation, and two antagonists would be passive internal rotation and scapular retraction. So 4 sets to 10 to 12, whichever way you want, or for the doorway stretch, 4 sets of 10 to 12 seconds would be ideal. So it's the same thing when you stretch and work out. I would typically like to do 10 seconds, or like for 10 seconds, 10 reps. So that's how you do a stretch. Okay, so for rehabilitative exercises would be two agonists would be side lying external rotation and wall slides, and two antagonists would be internal rotation with a band and pendulum swings. And typically, since it's more rehabilitative exercises, 3 sets of 8 to 12 body weight would be enough. Thank you. Okay, an MCL strain slash tear. An MCL strain or tear commonly takes place when the knee is experiencing stress or goes through a lot of pressure. A forceful impact, twisting, bending, repeated stress, and especially in wrestling, awkward landings will cause an MCL strain slash tear. The anatomy of this would be the bones and muscles that are affected by an MCL are the femur, tibia bone, plus the adductor mangus, due to its attachment near the MCL insertion point. Commonly, MCL injuries only affect the two bones, which can also affect surrounding muscles and ligaments. So, an MCL strain affects a good amount of part of the knee. So, yeah, there's that. Okay, an MCL strain slash tear cement test and treatment. Okay, for the first tear, it would be the palpitation test is when they check for tenderness, swelling, or thickness along the inside of the knee. The second assessment would be the valgus test. It's when the examiner applies slight pressure to the inside of the knee to test the stability of the knee. And the treatments for this would be resting, icing, elevating the knee, also taking painkillers, and also using a knee brace. Yes. The MCL strain tear / exercises. So for the 4 preventative exercises, there would be 2 agonists, which are squats and walking lunges. 2 antagonists would be deadlift and hamstring curls, and the rep range would be 4 sets to 10 to 12 reps, choosing your own weight. 4 rehabilitative exercises are 2 agonists, heel slides, and straight leg raises. And the 2 antagonists would be hip extensions and bridging. And the rep range would be 3 sets of 8 to 10 reps body weight, since you are recuperating. Okay, the last but not least, patellar bursitis. A patellar bursitis commonly takes place when there's repetitive kneeling, and in the wrestling mats, there's constantly, when you're in wrestling, there's constantly kneeling. Direct trauma from the hit to the mat, like, would affect that, or accidentally hitting someone with their knee, would cause it out, like, as well. Also, an infection can cause this as well, since the bursa sac can get infected and can cause a similar feel from an injury, but this is less common. So if you have one, check it out. You gotta check it out, since it couldn't be infected. Okay, the bones affected are the femur, tibia, patella, fibula, since these make up the knee. Direct impact from a hit will cause swelling and will cause a buildup of liquids around the area over time. Okay. The assessments for patellar bursitis and treatment would be an X-ray test can show if a patellar bursitis is actually present, so get an X-ray. The second assessment would be a needle aspiration is used to see if the fluid inside the injury is normal fluid or it's infected. So that could also be a process. And the treatment for this would be icing, resting, elevation, and painkillers. Also, antibiotics if you are infected. Okay, so the patellar bursitis exercises would be 4 preventative exercises. 2 agonists for this would be quadriceps isometric wall sits and heel slides. 2 antagonists for this would be straight leg deadlifts and calf raises. 4 sets to 10 to 12 reps, you choose the weight. 2 agonists or 2 rehabilitative exercises would be, for 2 agonists would be knee bends and standing knee stretch, and the 2 antagonists would be heel slides and seated toe touch. And this typically would be 3 sets of 8 to 10 body weight, since you are recuperating. Yes. And here would be the link for this presentation. It will be on this video. It will be on this slide. And here are my references. Thank you very much. Thank you.